Hello, and welcome to the RCC information session for how to become a nurse. I am Dr. Becky White, the program head for the Associate and Practical Degree Nursing programs. We have various ways that you can get to the end goal. We have the practical nursing pathway, and we also have the registered nursing pathway. So what path is best for you? Really, it is always recommended that you apply to both programs. However, some students opt to apply to only one, and there are separate application links for each. So the ADN and LPN programs are very restrictive here at RCC. There are additional requirements to apply for these programs over and above what it is that you would regularly do to come to Rappahannock Community College. We have a small space and a small number of faculty, so we do have limited seats, but we want to make sure that we are able to support you through your journey. The application process is very rigorous, and I'm going to go over the steps of that. Submission of the application does not mean that you are accepted. There is a committee that meets and makes a decision about those things, and your application must be evaluated within the pool of applicants in order to see if you're eligible to attend. When you're thinking about whether or not you're going to apply, I need you to be aware if you are on a do not hire list for any local hospital for any reason or any other facility, because we do go a lot of vast and varied places for clinical. We go from Mary Washington Hospital in Fredericksburg all the way out to Centera Hampton. So anywhere in between, we could potentially go. Another thing you have to do is make sure that you are enrolled in pre-nursing or pre-practical nursing prior to application. We want you to make sure that you understand that this program does cost money. You will be required to purchase and begin the work of entry once you have purchased certain things, once you have been accepted. You will also need to make sure that this program is for you, because withdrawing a few months into the program is really tough, and students that could have had a seat might not get a seat. So make sure that your Success Navigator works with you to make the right decision for you. Start working out a plan for your life now so that you can see how you're going to make it all work once in the program. So as I mentioned, there are two tracks. We are now admitting both tracks in the fall and the spring. In the fall for an August start, and in the spring for in the spring for a January start. We have the Associate's Degree Nursing traditional track and the LPN to ADN track, if you're already a licensed practical nurse, that will get you the Associate's Degree in Nursing. So again, as I said, you have to be admitted to RCC. All of your official transcripts have to be at the registrar's office. It is now time to begin your financial aid prep, doing your FAFSA and applying for scholarships, and also completing all academic requirements. The applications are due the first Monday in March by 5 p.m. if you would like to start the program in August, or the first Monday in October by 5 p.m. if you would like to start the program in January. If you're accepted, there is a mandatory orientation. And if you do not come, we move on to the next person in line. You also have to have be a high school graduate or have a GED and, complete all of the enrollment requirements that I just mentioned and have some competency in science knowledge. You also have to have competency in mathematics as evidenced by the math placement into 154, or to say that you are at least ready for college level math. It is required prior to applying that you take English 111, Bio 141 or 145, Psych 230, Health 230, and SDV 101 at a minimum. You also have to take the Kaplan entrance exam and have a 60% overall or 45 in each category. This test score is good for 3 years, and you can take it 2 times in the academic year. So if you take it the first time and you don't love your score, you can always take it again. For the LPN to ADN, very similar requirements, except that you also have to have completed Bio 142. The Kaplan requirements are the same, and the rules for Kaplan apply the same. Due dates are also the same for all three of our programs. For the LPN to ADN, again, that would be the first Monday in March for an August start, the first Monday in October for a January start. And each part of the program does have a mandatory orientation. Practical nursing is also admitting in both fall and spring. And again, do those same timeframes, and we'll still, again, have a mandatory orientation. To begin the PN process, you have to be admitted to RCC. Again, have all official transcripts evaluated by your advisor, and then file for financial aid. Again, now is the time to fill out that FAFSA. You don't want to get behind on those things. You do have a little bit of a different Kaplan admission requirement. You must have a 45 overall and a 35 in each category. PN doesn't really have prerequisite coursework, but it is recommended that you are a high school graduate or GED. That's actually required, excuse me. You also have to have at least 1 unit of high school biology or college biology and complete any type of developmental ed. I know one of the newer things is that when you're taking your anatomy, they may accompany that with an NAS2, and that's kind of a booster course to get you ready for your anatomy and physiology course, which is very important in nursing. You must have a Kaplan of 45% overall and 35 in each category, and a cumulative GPA of 2.0. For every part of our program, students should start practicing for the Kaplan. You can certainly purchase any Kaplan entrance exam prep guide on Amazon or Nursing Entrance School Test Study Guide. You have to study for that test. Don't just show up and take it. I recommend studying and then again, remediating if you don't love your score and retaking it. You also need to make an appointment with the RCC Testing Center to take the exam. Plan for about 4 hours for the test. It's a long test. You can plan for a morning or afternoon, whichever your appointment is, but you have to notify the testing center and ask for that appointment. And the Kaplan test is free. You just have to say you're coming. When you're ready to apply, you want to electronically complete the application. You can find that application on the website. Visit rappahannock.edu, click on Explore Programs, then by Career Pathway, then Healthcare, and then Nursing. And that will take you to the different parts of the program, which also has the application instructions, the ranking policies and procedures, and the application itself. Once you're accepted, you will be required to complete a criminal background check and a drug screen. You will have to be screened for TB and receive medical clearance. And there are several immunizations that has to be done. We do that through a process called Castle Branch, and that is something you will learn about at your mandatory orientation. You will also be required to have BLS for healthcare provider CPR. We recommend American Heart because that just keeps it simple. Some students have had others, but as long as it is BLS for healthcare provider, that's going to be the most important. You will need student liability insurance, and then the the essential function test essentially is a form that you will sign saying that you can lift patients and do the physical job of the nurse. You also need to remember what I said about planning and financial readiness, FAFSA, plans, backup for your backup, right? And scholarship. I'm sure you have questions after all of this. And so please make an appointment with your Success Navigator today so that you can get with them and make sure you have all I's dotted and T's crossed so that you will be successful in the RCC application process as a nurse. We thank you so much. My name again is Dr. Rebecca White, and my email is rwhite@rappahannock.edu. And I'm only an email away. Thank you. Bye-bye.